For those of you joining us on Facebook, we'll be starting in about a minute or two. Bear with us. We will start just about at noon. Thanks so much for joining us.
Okay, we're live. All right, can I go ahead and get started? I think it's noon.
Yeah, that would be great.
Wonderful. So hello, everybody. I'm so excited to have you here and to be sort of convening this wonderful event. Today, we'll be discussing the implications of the debate surrounding Roe v. Wade in reproductive health services in North Carolina. My name is Issa Vanderdrift. I'm a public health analyst at RTI International, but for this event and for this organization, I'm a WomenNC board member as well as a former scholar. I was a scholar in 2019 to 2020, and my project looked at sexual and reproductive health education and services for young women in Durham, North Carolina. So this is a topic that I find really interesting and important, and I'm excited to learn more about the wonderful work our panelists do and how North Carolinians can best support and uphold reproductive justice in this state. So I'll go ahead and get started with introducing everyone. So our first panelist is Tara Romano. She is an executive director of Pro-Choice North Carolina. Next, we have Monika Thigpen, who is a senior director of education at Planned Parenthood South Atlantic. Next, we have Camille Adair, who is a policy and movement building manager at the Carolina Abortion Fund. Finally, we have second to last, we have Maya Hart, who is a North Carolina coordinator for SisterSong National Women of Color Reproductive Justice Collective. And we have Patrick Summers, who is the director of strategic initiatives at Planned Parenthood South Atlantic. So I now will be turning it over to the executive director of WomenNC, Maria Murray Ryman, to get started with this panel and conversation.
Wonderful. Thanks so much, Issa. And thanks everybody on Facebook that's joining us. We appreciate that you've joined us for this very important conversation at a very important time. So before I let the meat of the program begin, I want to let you know that my colleague Ava Smith is monitoring the comment section on our Facebook Live. And so as we move through the program, if you have questions, if you have comments, please type them into the comment section, and we'll have a little bit of room later on in the program for Ava to read some of those questions and comments and have our panelists respond to them. So please do that. I'll try to remind you as we move through, but we want to hear from you. We want to know your questions. And again, we're so glad you joined us. So let me then turn it over to Maya. And please tell us a little bit about your organization, what you're doing, and what we should know, we the audience, about your work. Maya?
Absolutely. Thank you so much for having me. I'm going to share my screen here. And thank you all so much for having me. I am Maya. I'm the North Carolina coordinator with SisterSong Women of Color Reproductive Justice Collective. And I'm really here this afternoon to tell you a little bit more about SisterSong, our organization, and also really make sure we're grounding the conversation today in reproductive justice, and that we're centering historically oppressed communities when we're talking more broadly about abortion healthcare and abortion access. So SisterSong was founded in 1997, and we are a national Southern-based membership organization working to build an effective network of individuals and organizations to improve institutional policies and systems that impact the lives of marginalized communities. Our mission is to strengthen and amplify the collective voices of Indigenous folks, Black people, women of color, and gender oppressed people broadly to achieve reproductive justice by eradicating reproductive oppression and securing human rights. And a little more on the background of the framework of reproductive justice and our organization SisterSong. So back in 1994, 12 Black women came together and recognized the ways in which they didn't feel centered or included in the conversation around reproductive health care and access. So they came together in 94 and coined the term reproductive justice. 3 years later, in 1997, SisterSong was created by 16 representatives of 16 different organizations who represented 4 different communities, including the Black community, Indigenous community, Latinx folks, and Asian Pacific Islander community. And Luz, who's on the left of your screen, was a founding mother of the organization SisterSong. And Loretta on the right, Loretta Ross, is the founding mother, one of the founding mothers of Reproductive Justice, as well as the first national coordinator of SisterSong. And before moving forward, I just want to make a note here and want to ensure that in our conversation this afternoon that we're really intentional about language. Oftentimes we use woman as the default for someone who needs access to abortion or reproductive health care broadly, but I want to make sure we're being really inclusive of all folks, including trans and gender nonconforming folks with uteruses who need access to reproductive health care and abortion. So just a note there before moving forward. And so SisterSong defines reproductive justice as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. And there are 4 principles to reproductive justice. Those are: every individual has the human right to 1, decide if and when they will have a child and the conditions under which they will give birth. 2, the human right to decide if they will not have a child and their options for preventing or ending a pregnancy. 3, the human right to parent the child they already have with the necessary social supports in safe environments and healthy communities and without fear of violence from individuals or the state. And 4th, the human right to bodily autonomy, free from all forms of reproductive oppression. And just want to point out here, when we look back at number 2, I think people often think about reproductive justice and think about specifically giving birth and maternal health and raising children, but it actually is just as much about having access to the resources and knowledge necessary to prevent or end a pregnancy. So I just like to name that here when we're talking about abortion access. And then here, I think that historically the conversation around abortion has really focused on choice and legalizing abortion, which is of course important and one of the reasons we are all here. But I also want to name that even with Roe intact, people are still experiencing barriers to accessing actual abortion care. So we really need to push beyond choice and think more about access, who does have access, who doesn't, and historically what that has looked like. And doing so requires us to focus on our human rights, and reproductive justice as a framework is grounded in the human rights framework. So when we think about access to abortion care, we have to center historically oppressed communities and consider their access to this care. And in naming that as well, that pushes us to think beyond women and include not just cis women, but queer and trans folks as well. And we have to consider barriers, which looks like considering the cost of an abortion procedure, transportation, how are folks gonna get to the center, and also thinking about childcare. If folks have other children, how are they gonna, do they have to take off work, and what does that mean for their children? So these are all the things I mean when I'm thinking about access. And then, so the image here is just to remind us that when we're looking at reproductive health and rights work, which is equally as important, but just making sure that those services are also grounded in the reproductive justice framework as well. And finally, just want to leave y'all on a positive note and really describe and name when we name reproductive justice, when we talk about reproductive freedom, what does that actually look like and mean? So our vision, SisterSong's vision for reproductive justice and freedom is when it will have been achieved when all people have economic, social, and political power and resources to make informed decisions about our bodies, sexuality, and reproduction for ourselves, our families, and our communities in all areas of our lives. Thank you.
Thanks so much, Maya. Appreciate your framing this conversation. And now let's move on to someone with a different perspective or a different vantage point. Tara Romano, the floor is yours.
Great. Thank you, Maya, for that introduction. And thank you, WomenNC, for hosting this panel. I'm really glad to be here. So I'm Tara Romano. I use she and her pronouns. I'm the executive director at Pro-Choice North Carolina. And we are an advocacy organization statewide that we focus on creating a world and a society that really gives people what they need materially and in terms of support for any reproductive healthcare decisions they make, whether that is preventing a pregnancy, whether that is terminating a pregnancy, or whether that is carrying a pregnancy safely to term. And as a reproductive rights organization, we have always also focus on the stigma surrounding all reproductive health care, particularly abortion. So we do want to make, as an organization, make sure that we are helping people to bust down the abortion stigma that often contributes to a lot of the restrictions on abortion care. So in my 5 minutes, I am going to quickly tell you about the current state of abortion care in North Carolina, the current state of access, some of the challenges, some of the things that we've been able to, some of the successes we've been able to have, and then very quickly court and what we might be able to expect in North Carolina. So North Carolina is it is in some ways a more moderate state in some ways in the South when it comes to abortion access. It has a history of that, but it is actually considered quite hostile when it comes to actual access. As Maya mentioned, like transportation can be an issue because the clinics are really clustered in metropolitan areas. And there is one clinic in the western part of the state, and there is one clinic in the eastern part of the state. And then they're clustered in Charlotte, the Triad, and the Triangle, and then Fayetteville. And then there's a lot of places, most of the counties don't have a clinic. So you have to travel to get to a clinic. We're in a pandemic that makes traveling harder. We also have a 72-hour waiting period. So that is also another barrier for people trying to access care. I think all public insurance in North Carolina and a lot of private insurance also is banned from covering abortion care, or just doesn't do it, which again is a huge barrier for people trying to access care because their insurance won't pay for it. So they have to then come up with the money for this, usually likely a procedure that they had not had planned for. And then also we just have a lot of restrictions, a lot of arbitrary and political restrictions that target providers and target patient care. And also a lot of our clinics face escalating harassment from protesters in front of clinics. So there's a lot of barriers, even though we are probably in better shape than some of our other southern neighbors. There's a lot of barriers already. And some of the challenges that we're facing are a General Assembly that is gerrymandered and extremely hostile to abortion access. They also continue to give increasing amounts of funds to anti-abortion fake clinics, otherwise known as crisis pregnancy centers, while still not expending Medicaid. So you have people who don't have access to healthcare then kind of being funneled into places that say they're offering free healthcare when in fact they're just offering anti-abortion ideology. We also have, you're starting to see now particularly in rural counties, the county commissioners are passing anti-abortion called pro-life resolutions that are intended to shame and disparage people who seek out abortion and people who provide abortions. So those are some of the challenges that we're facing. Some successes that we've had are, I do want to, to lift up that actually they haven't been able to pass any more restrictions in North Carolina since the 2017 session. And that is because of the work of advocates who have made sure that we have been able to vote in people who protect abortion access, including having a governor who will veto anti-abortion bills, been able to uphold those vetoes. We are shining a light on CPCs. They are still giving them money, but a lot more people are starting to learn about what the problems are with CPCs, the anti-abortion clinics. And then we also, and when it comes to local resolutions, I mentioned the anti-abortion resolutions, but North Carolina also has 4 local governments that have passed resolutions calling on the federal government to repeal the Hyde Amendment, which is the ban on Medicaid coverage for abortion care. It's economically unjust, and we have 4 local governments that have done that, which is the most of any state in the country. So we're proud of that work of advocates. And quickly, my last minute or two, I just want to mention that we are watching what is happening at the Supreme Court. I mean, we are already considered a hostile state for abortion access, and while we do not have what is called a trigger law, like a lot of other states, meaning if Roe is overturned at the Supreme Court level, abortion is automatically banned in our state. We don't have that, but we also don't have any protections. And we have a hostile General Assembly, and we have an election this year. So we are concerned about what might happen if the Supreme Court, even if they don't overturn Roe, but more severely gut it, meaning like they allow more restrictions to stand that have been previously unconstitutional. We anticipate that things will get harder for access here in North Carolina. So we're definitely going to be watching it. And we never know what the Supreme Court is going to say, but we have a pretty good idea in this case, I would say. So that is just, let me just wrap that up. So thank you all for joining us, and I will turn it back over to the moderator.
Thanks so much, Tara. You raise important concerns about an important part of reproductive healthcare access and justice. not the only one, but a very important one that many people in this space are worried about at this particular time. Thank you for that. Let me turn it now over to Patrick, who's going to talk a little bit about Planned Parenthood of the South Atlantic and the breadth of services that this organization offers when we speak about reproductive justice and reproductive healthcare access in North Carolina. Patrick.
Thank you, Maria. Good afternoon, all. My name is Patrick Summers. I am the Director of Strategic Initiatives at Planned Parenthood South Atlantic. Our affiliate covers 4 states, North Carolina, South Carolina, Virginia, and West Virginia. But today I'll be focusing on our North Carolina clinics. And I apologize, my cat is trying to get in front of the screen. So, as many of you probably know, Planned Parenthood offers a full range of sexual and reproductive health care. This ranges from family planning to gender affirming care and proudly abortion care. In 2021, we served over 38,000 patients in North Carolina. 22,000 of those were between the ages of 20 and 29, and almost 5,000 of those were teens. We serve patients of all gender identities, but 34,000 of those patients had uteruses. We offer our family planning services. We offer annual exams, STI testing and treatment. We have problem visits like UTIs and BV. We offer pregnancy tests and options counseling. We also have options for telehealth for most of our services, most of our family planning services. And we would have that for abortion if North Carolina allowed us to. Virginia does. And we offer all forms of birth control. So this year we provided almost 10,000 patients with pill, patch, or ring, and we offered over 5,000 patients long-acting removable contraceptions, implants, or IUDs. For our abortion services, we've provided care for about 12,000 patients. The majority of those come from North Carolina, South Carolina, and Virginia. But I can tell y'all that we have seen an uptick of patients coming from out of state. We saw 18 patients from Texas, and we know that that is not a short trip. And we're also seeing patients coming in from Tennessee. So we saw over 120 patients coming from Tennessee recently. I'd like to talk a little bit about the barriers that both Maya and Tara brought up. We and our patients face unnecessary regulations that both delay and stigmatize abortion care. These include the 72-hour consent, trap laws, targeted regulation of abortion providers, which become very expensive when they make onerous requirements on buildings, facilities, infrastructure. And there's also requirements for the type of personnel that we have on site, regardless of whether it's medically necessary. And then there's parental consent requirements. So minors are unable to seek abortions with their own signature. So we have been working really hard to help patients overcome some of these barriers. We partner with organizations like CAF, who you're going to hear from next, to help patients find funding, and they have troops on the ground that provide a lot of other support. And then one of the things that I'm most proud of is our partnership with UNC Law. And this is another program that we partner with CAF with. It's Text Abby. So for any minors seeking an abortion whose parents will not consent, we're able to hook them up with a pro bono lawyer from UNC Law. And then we coordinate to make sure that they can get that bypass the same morning of their procedure. So if they're taking time from school or they have to keep this a secret, we're able to support them through that. And then finally, I like to highlight the hard work that our patient navigators do. These regulations are different from state to state. People traveling can have a really hard time figuring out how to navigate the regulations and resources. So we have someone on site that when a patient needs a little bit of extra care, we're able to help them navigate through getting funding, getting rides, finding childcare, covering these other incidentals, and then also getting them that 72-hour consent and allowing them to come into the clinic for the care they need. Thank you all for your time today, and I look forward to your questions.
you so much, Patrick. It's really important to place abortion access, abortion care within the larger context of reproductive justice and reproductive health. And I think what you've told us about Planned Parenthood is that that you are a part of that larger conversation, and I thank you for that. Let me move on now to Camille, who'll tell us a little bit more about the work that she and her organization are doing to ensure reproductive justice and health access. Camille.
Thank you so much, Maria, and thank you guys so much for having me. I'm going after some absolute powerhouses, and I'm just going to try to build upon what everyone just spoke about. Can y'all see my screen? Awesome. Okie doke. I didn't know what to title this, so I thought Carolina Abortion Fund in times like these summed it up really well. My name is Camille Adair, and I'm the Policy and Movement Building Manager at Carolina Abortion Fund. I am both a person organizing on the ground as well as a person politicking and advocating to officials based on what folks really need. An issue on the ground in abortion can be as simple as, dang, I really wish I could just speak to someone virtually. I don't have the spoons to go all the way to the clinic an hour away from me. And translating to lawmakers, for example, in the Carolinas, we need access to services through telehealth that include all providers, all payers, and all forms of insurance as an avenue to having that need met. On the ground is terminology we use for grassroots community organizing, and something I may say a lot throughout my spiel. On the ground is also an amazing play on words for me when I think about doing both policy work and community building. Community is where our policy work should be grounded. The people should be the core of our legislation. When many of us look to our state legislation around abortion, which in CAF's case is both North Carolina and South Carolina, it is clear how little community is reflected in abortion-related policy. I also have little sheets of paper. Abortion policy isn't limited to pieces of legislation that outright expand or restrict abortion, mirroring reproductive rights not equaling reproductive justice, as Maya spoke about previously. For every piece of legislation that expands healthcare for all, there are always loose amendments and at least 200 bills restricting that access. Abortion providers are burdened not only by their caseload, since there are often few and far between, especially in the Carolinas, where we have a provider shortage, but by TRAP laws, which are targeted restrictions on abortion providers. These laws add unnecessary regulations to providers' work that can shut abortion providers all the way down. According to the Guttmacher Institute, this has cost the South 50 clinics. Consider also my previous statement about expanding use of services through telehealth to include all providers. In conjunction with being limited to abortions in clinics by providers, multiple avenues to autonomy are blocked for us in the Carolinas. We may have rights in writing, but without every single person's access to those rights being cleared, there is no reproductive justice. Your legal rights can be altered with a pen stroke, but justice is not that malleable. These policy wars have been going on for the last 49 years, adding hurdle upon hurdle to abortion providers, people living check to check, Black and Indigenous people of color, and even more specifically, queer and trans people of color. Less clinics means more traveling, means more folks removing themselves from their communities and their preferred transitional guides, means more hoping where you're going won't misgender you or worse, complicate your already complicated scenario. If you're unwillingly pregnant, if you are a trans person, it's one thing to have to sort through CPCs to find a real clinic. It's an entirely other concept to be afraid to be clocked by anti-abortion protesters on your way to a clinic you've never been to, fearful that the clinic will be no different. It means allotting for at least $450 to get an abortion, and then cost for travel, cost for food, cost for aftercare. It means risking getting a medication abortion illegally. It means risking getting abortions illegally. And it means a disproportionate amount of folks and providers having criminal implications over their choice. It is not enough to keep abortion safe and legal. We need for abortion to be accessible. So now I get to talk about what we're doing here at CAF. We try to fill these state mandated gaps with direct action. We are funding abortion. We operate a warm line, as we call it, between Monday and Friday, 9 to 5. And as Patrick spoke about beautifully, we also run Tex Abbey. We have been here now for about 11 years. And we also provide doula support as well for our abortion callers. We are always looking for volunteers. We are always looking for sustainers. We are also always looking for donors. And I will definitely drop links for how to get involved there as well. I'm gonna close out by being my whole self. I am a queer, Black, dark-skinned mother. I'm a doula, and I'm an organizer in the South. My community is of folks who do not and cannot depend on the flimsy fabric that is policy, who do not keep up with elections because whether we like to hear it or not, their lives stay on the same trajectory, and who are purposely excluded in legislation and otherwise do not have access to abortion whether or not Roe stays intact. Supreme Court case Roe versus Wade has always been America's legal floor for access, defining abortion access for only women, as well as giving states the rights to append that limited access further. By 2022, the discussions we want to be having are about building upon Roe. I want to be talking about expanding access to all genders, all body types, all counties, all communities, and all abortion practices. I'm closing out with abolition, because our communities need refunds. Our fiscal budgets need to be reflecting our people, but they don't, just the same way that our laws and our policies don't. We are out here funding CPCs from here to Texas and North Carolina, very public information that I will happily drop in the chat as well. And I would rather see more providers. I would rather see more midwives. I'd rather see more doulas. I'd rather see more anything else, handball, I don't know, and childcare, and that's it. Refund our communities.
Thank you so much, Camille. Your work on the ground is really important for all of us to hear about the struggles that take place within communities that have often been left behind, especially with your emphasis on how laws are nowhere near enough to ensure any kind of justice. So that those words and that emphasis is appreciated. Thank you so much. We're going to close out this part of our discussion with Monika, who's going to talk about her efforts in a different aspect of reproductive access and justice. Monika, let me turn it over to you to tell us more about your work in the context of reproductive access and justice in North Carolina.
All right, sorry about that. Thank you all so much, and thanks for inviting me to this live chat conversation. And I'm going to follow a bit around from Patrick. I am Monika. I'm the Senior Director of Education for Planned Parenthood South Atlantic. It's very difficult, but I'm going to try to do it in 5 minutes or less to talk about the amazing job that my staff does with education. So as Patrick spoke, we provide education in North Carolina, South Carolina, Virginia, and West Virginia. And so in North Carolina, we provide education in Charlotte, North Carolina, Asheville, Fayetteville, Winston-Salem, Chapel Hill, and Durham. And so we are lucky to have funding from donors, grantors, and we have an amazing CEO and board that really support the education that we do. We have a program called Teen Connections, and Teen Connections, we work with parents, teens, and community partners. All the staff are trained in what we call evidence-based programming, which means all the programs or curriculums that we provide, trainings for they have all been tested and proven to increase knowledge and change behavior. Since the pandemic, things have changed so much for us and we've had to go virtual, but we made it and we're still training teens and parents. Thus far, the affiliates we've trained over 7,738 teens virtually. North Carolina, we've trained virtually about 4,725 teens and parents, and outreach about 695 folks in our communities. So we're still on task working with teens and families. We work with all teens. It has nothing to do with the the socioeconomic background. If you're a teen, you qualify. Our teens, we work with teens, work with their parents, and we have a specialized program. We have a program that we work with just the LGBTQ plus community, the Latinx program, and also we have a statewide program that we're so excited to. So it doesn't matter what part of North Carolina someone is in, they can still be part of our training. The teens have fun. They learn to be peer educators because we believe in educating teens about conversations that they're already talking about. So we want to give them the accurate information. And we have the training for our parents is because we want to also be sure that we are opening the lines of communication or keeping those communications are open. Our teams, once they complete our program, which is absolutely amazing, they have a stipend of $100 when they finish because we feel like this is a job for them. They're coming in to learn this all accurate information and to talk to their peers to give them that information. We also have within our program for our parents, they also can earn a stipend. Even since the pandemic, we haven't forgotten the fact that there's been some struggles in families. So we also want to provide teens with dinners or lunch when we're doing the training. Nothing has changed for us. We're meeting families where they are. And I have the most amazing staff that is intentional about doing that. We have games that we're playing with our teens online. They are involved and they haven't missed a beat and they're still coming along. So I say with that, and I'm going to ask my assistant to drop a link in that if anybody's interested in our statewide program or local programs, to just send her email. But just want to let you know that we are still training teens and working with parents and doing those one-shot sessions, whatever topics that may come with us. We also, I do want to speak about this. We've also provide training for our IDD community because we want to meet all people where they are. That's what Planned Parenthood does. We're meeting people where they are at all times. So I welcome your questions and any support you want with our program. And thank you again for joining, and thank you again for inviting us to this live time. Thank you.
Thank you so much, Monika. I appreciate that and sort of grounding us in the conversation about the need for a range of services, a range of providers, a range of approaches to reproductive health care access. We are on the 49th, right before the 49th anniversary of Roe versus Wade. Many of you have talked about the limitations of that law, but also Monika reminds us, as many of the other panelists have as well, that laws are not enough. Money to fund abortions is not enough. Education is vital to preventing unplanned pregnancies, to facilitating communication between parents and children or youth. And so you sort of bring us back to the title of our event, which is Reproductive Health Care Access. I'm going to ask a question or two of our panelists. Oh, by the way, for those joining on Facebook Live, I mentioned this to the panelists. I might be a surprise. I am Maria Murray Ryman, and I am a executive director of WomenNC, and you didn't expect to see me today. Our fabulous board member, Dr. Ashley, contracted COVID and was not able to join us today. So we wish her good health, but we're so glad that our panelists are all healthy. Anyway, so just a note there, a program note. So I'd like to open this question up to the panelists. And while I'm doing that, my colleague Ava Smith will be looking at some of the questions and comments that you're making on Facebook Live. Please do drop those into the comment section on our Facebook Live. But let me ask you to say, and anybody can take this up, talk a little bit more about choice and access and rights and justice and how each of those terms has its limitations. I know several of you have addressed it, but let me open up that for a fuller discussion. What's the problem with rights? Why isn't choice enough? Love to have people comment on that.
Sure. I'm happy to start and definitely encourage other folks to chime in. I think so. Sort of in the diagram I showed, I think of reproductive rights as sort of the legal side of access and care. So the ACLU comes to mind when I think of reproductive rights, which is great and necessary, and we need folks doing that work. And then I also think of, sorry, I wanted to pull up my image here. And then when I think of reproductive health care, I think of a lot of folks on this call, like CAF doing direct service, Planned Parenthood doing direct service, and we need folks doing that work too. So it's not that one is right or wrong, but those services need to be provided in a mindful and intentional way that looks at historically and currently who generally has access to that exact those services. And historically, that has not looked like working class poor folks, queer folks, people of color, Black folks more broadly. So it's not just about can someone get access, can someone get an abortion, is that legal or not? But who actually lives close to the centers, who is able to travel, who can take time off work, who can find childcare, who has access to all of these resources that will even enable them to get the procedure that they need done. So all of those buckets of work are absolutely crucial, but reproductive justice just requires us to look at that work from a specific standpoint, pulling in our historical context with us of who is really able to get access to that care or not.
Thank you, Maya. Let me, as you were speaking, it made me want to ask a question of Monika, and that is when you talked about ability to access services. I think you were speaking specifically about abortion services, but I think about the work that Monika is doing with education. And I wonder, now that we're in the pandemic and you're able to offer some of your teen education programs virtually, if you have found that the services that you offer, in fact, have been expanded. There's sort of a bright spot. And I have no idea if that's true or not. If you could comment on that, I'd appreciate it.
Yeah, that's a great question. We have noticed an increase because sometimes we have those students that are doing all those extracurricular activities and they can't get to the trains, or those that have lack of transportation, or parents, when working with parents not being able to get to the trainings because they're working or whatever. So virtual. This has worked very well for us, and it is something, even when we get through this pandemic, we will definitely continue this. We have seen the benefits of it.
Thank you. Others who want to comment either on what Monika said or my initial question before we move on to some of our questions from Facebook? Go ahead, Tara, please.
And so that's a great question. I really appreciate what all the panelists have been talking about. And one of the things about like the rights framework is, as I think Camille mentioned, rights can be easily taken away by people in power. And we've seen that. And one of the things also is that focusing on making sure that abortion is legal is of course important, but we've seen how it's been chipped away at, but still left in place as legal. I mean, I remember when North Carolina in 2012 and 2013 started passing a lot of abortion restrictions, the talking point we were hearing from anti-abortion folks was well, it's still legal. It's yes, but people can't access it. And so what does it mean to have it legal and to have the right to an abortion when you can't access it? And the one way they've really tried to undermine it is by attacking the way people can pay for it. And really making sure that abortion, and to a lesser extent contraception, is not considered actual healthcare. And so that means that they can sort of carve it out and be well, your insurance can't cover it. And just getting insurance, so much insurance will not cover abortion care. And that is by design. And that is by anti-abortion lawmakers who didn't feel at that time that they could get rid of the right or the legal access, but then they knew how to undermine it by making sure people could not pay for it and then leaving them not being able to access something that is supposedly their right to do.
Thank you, Tara. Patrick?
Yeah, I'd like to piggyback off of Camille and Maya. When we look at patients coming from places like Texas, where the abortion law is so strict, it's basically a ban, we know that wealthy folks are able to fly out of Texas and get an abortion where they need to. So, it is not just Texans that are being hurt. It is the poorest Texans who are actually being hurt. And one of the things that we see when these barriers are increased is that people push out their abortion, and that increases the gestational age by the time they're able to access it. So that re-stigmatizes it. It makes it harder. It makes it a harder procedure. It makes it more expensive, and it makes it more complicated. So these barriers, they don't discourage everyone from having an abortion. They just make it harder to have an abortion, and particularly for those who can afford it the least.
Thank you. Let me turn now to my colleague, Ava Smith. Ava, do we have some questions or comments from Facebook that you would like to highlight?
Yes, we have a really great question. So it says, what do you all wish human service professionals in North Carolina knew about helping their patients or clients access abortion services? How do you see these needs shifting in post-Roe landscape?
I'm sorry, Ava, could you repeat the first part of that question?
Yes. So it says, what do you all wish human service professionals in North Carolina knew about helping their patients/clients access abortion services? I'll also post it in the chat.
So what do we need to know? What should people seeking abortions in our state know? What are the important points for patients or other clients who need to know and need to access this particular aspect of reproductive health care?
I think one of the most important things to know about in North Carolina is the requirement for the 72-hour consent that must be done by either a doctor or a registered nurse. So when you're scheduling an appointment with us, your first appointment will be a phone call. And then after that, on that phone call, you will be read a script that is state mandated by a registered nurse. And then 72 hours later to the minute, we can perform the procedure. So I think it's really important that we let people know about that, because it can be really confusing to patients. We've had patients show up to clinic instead of receiving the phone call, and it's made to be confusing on purpose. So I'd say that that's the number one most important thing for folks seeking abortion in North Carolina to know.
Thank you for that, Patrick. That is important to know. And I would say what I just learned is that 72-hour first touch, as it were, can be done on the phone. To me, that's something that I just learned. Perhaps some of you didn't know that as well. So while that is a limitation, it's also, it seems to me, a less onerous one than if you had to show up twice in person before receiving that service. Am I right about that?
We fought hard to make sure that that's the way it was interpreted.
Great. Anyone else like to talk about what they think our audience and any patients would need to know to access abortion services in North Carolina?
Patrick or anyone else, can you elaborate just briefly on the purpose, the reasoning behind the 72-hour rule, and who's enforcing that and why, or if you know the answer?
I think Tara will probably know more about this, but I believe it's a medically unnecessary requirement imposed upon us by the state to make operations more difficult and to make it harder for patients to seek abortion care.
Yeah, I will just add that it is medically unnecessary. It's the only type of health procedure where that kind of waiting period is put into effect. It's also stigmatizing, right? It goes into the stereotype that, first of all, that abortion providers are trying to coerce people into getting abortions, and also that people, particularly women who are seeking abortions, can't make up their minds, and that they're being capricious and they don't know what's going on, and it's demeaning, and it's just there to make people wait. And actually, studies that they have done about the waiting periods have shown that waiting periods don't really change people's minds; they just make people wait.
Okay, and following on that, I mean, it's not quite following, but sort of. Tara, you brought it up before, and to me, an acronym was a little bit unknown to me until I did a little bit of research. Talk a little bit about CPCs. Several of you have mentioned them. It seems to follow on perhaps part of this discussion. Perhaps you could tell us a little bit more about CPCs and how you take them to be, I take it, not something to applaud.
Well, definitely. Thank you for bringing that up. And one thing, like, I do think, I wish, back to the question of what health human service professionals in North Carolina would know, is that there are these things, there maybe crisis pregnancy centers might be how you hear them referred to. We call them anti-abortion fake clinics, but knowing that they're out there, because they are there specifically to intercept people who are trying to access abortion. So they will do that in ways like trying to pretend to be a clinic, trying to pretend to be a medical clinic, just to get people to come in so that they can then talk to them about, like, and give them a lot of misinformation about abortion, contraception, how to access care, like even maybe like trying to just, if they know that the person might be trying to seek an abortion, just trying to delay them in getting that care. And as Patrick and others have mentioned, that care is time sensitive. So I think, and if anyone else, I don't know if folks at the Carolina Abortion Fund want to talk a little bit more about, like, you know, they talk to patients who may have been out there, you know, like, so wanting to make sure people know that these places are out there, they exist just to push anti-abortion ideology and to block people from accessing care, and that they also are not providing health care. So people should not be referring to them, which is one of the challenges. We see people who maybe just don't know, see this in the phone book, and they think, okay, and they refer people to them to get like a free pregnancy test, and then they get ensnared in this this anti-abortion ideology.
And just to highlight how insidious these fake clinics are, they build them right next to our clinics, and just to make it even more confusing. They build within proximity of abortion clinics just to make it harder.
I do want to tap on to, as for the question, what I wish all human services professionals here in North Carolina, as well as all states, knew. There's probably an abortion fund in your state, and you should be aware of that abortion fund. Most of us are operating very similarly. We are providing travel support. We are helping them with partial support for the abortion. We have a text service as well as call service. We make so many routine follow call-ups just to make sure they're okay, even if it's not even important. I just want everyone to be aware of their abortion fund in their states, please. It's a very important resource.
Thank you. Thank you very much. I'd like to ask Monika, since she's involved in a different aspect of reproductive health care, how do you approach, or do you, with your parents and your teens who attend your programs, how do you talk about the full scope of reproductive justice as you try and educate people, facilitate communication, and frankly, not turn people off? So I'm curious how you, perhaps it's not a fine line. It seems like it might be a tightrope for me. So I'm just curious how you broach the topic of reproductive health care and in its full dimension with your clients.
Yeah, one of the things we do, as I spoke about, is we definitely teach from curriculums. We're not trying to, we want parents to be able to trust us, and we're teaching from curriculums that, as I said before, that are already tested and proven to change knowledge and behavior. So we're and every child is different, but we refer them to our clinics or clinics that need to be. But we're not sitting around teaching about abortion. Our curriculums don't teach us that. We're teaching from curriculums, and we teach with fidelity, which means we're not going in changing curriculums. We're doing exactly what that curriculum that the Health and Human Services has said, check, this is a great curriculum to teach and work with teens.
All right. I have another question, and I'll throw it out to the panel. I think you've talked around this, but I'd like to for us to get a little bit more specific about the ways in which your organization does, or perhaps commenting on others, eliminate some of the barriers that you have mentioned for people to access the full scope of reproductive health care? How are you eliminating barriers? What needs to be done? What isn't being done? Kind of spell it out for us so that we as the audience have a good sense of what's working, what's not, what barriers are being eliminated, what still remain. I'll be quiet now and open it up to the floor.
I can start with a little bit background. I think SisterSong, we're not direct service in the way that a lot of folks are on this call. So my role thinking about reproductive justice and abortion access is really education around letting folks know how abortion access fits into the reproductive justice framework, and that if you're a reproductive justice advocate and organizer, you therefore have to be in support of not just abortion access, but actually expanding abortion access and really supporting and being pro-abortion access. So like I mentioned briefly, reproductive justice is so much more than just birth, maternal health, the Black maternal health crisis, and supporting folks who have children. But again, making sure folks have access to the knowledge and resources they need to be able to prevent or end a pregnancy. So for us, it's much more of the educational piece and piecing these different movements together to really recognize how intertwined all of the fights are.
Well, and that seems to me that ties in really nicely with the work that Monika and her team are doing. You've underscored the importance of education for the variety of ways in which we see interlinkings of the different aspects of reproductive justice and how they are intertwined, and how, Monika, more than a 1 hour Zoom call is needed to educate all of us on their interconnectedness and what we need to do. Others who want to chime in about eliminating barriers to abortion and more broadly to reproductive justice, what you're doing, what needs to be overcome.
I feel really hung up on the phrasing eliminating barriers, but because
how would you phrase it? Tell me a better
Carolina
way.
Abortion Fund, we're definitely providing direct service. We're definitely doing like mutual aid, direct action, but what we're doing is just like meeting a need. Like even if we were able to fund every abortion that needed to happen today, tomorrow there'd be more abortions. And on top of that, tomorrow we would still need funding. Tomorrow people would still need their own funding. Tomorrow people would still be hungry. Tomorrow people would still be going through all the other things that actually are intertwined into abortion access that we don't be thinking about. And so I don't feel like any of us are at this point eliminating barriers, but we are for sure doing the work to try to uproot and append some of the damage being done to us. So I think I'm gonna stop there.
And to build on what Camille was saying, it's going to take a lot to be able to eliminate all those barriers, and what Maya was saying about helping people know how they can access abortion care and all reproductive health care and what to avoid as well. And to go back to when I was talking about the anti-abortion fake clinics, the crisis pregnancy centers, they exist to, first of all, they are getting public health funds from our General Assembly that are then being diverted from actually evidence-based public health funds. Like Planned Parenthood and independent abortion clinics certainly don't get any state funds to do the care that they need to provide. And so making sure that people know that those places exist is one way to help people make sure they get to the right care that they need, because there's over 100 of those places in North Carolina compared to 15 abortion clinics. So, making sure people when they are looking for where they want to get care, and then when they're making those calls, that we're at least trying to help them understand there are certain places that if you are looking for comprehensive reproductive health care or abortion access, those are not places to call. So trying to at least do the education so that people are able to at least know where to start when they are looking for access to care, and they don't get ensnared in places that are really there to exploit vulnerabilities that are that exist about why people are trying to access care, particularly if they don't have the funds to do so.
And
Thank you, Tara. I'm going to turn it over. We have another question or two from our Facebook page. So let me turn it over just for a minute to Ava Smith. Go ahead, Ava.
Yes, someone asked a question that says, our tax dollars fund this horrible crisis pregnancy centers. How can we stop this?
Attend your city and county council meetings where budget items are being discussed. If you are someone who prides yourself on voting, that has the availability to be active politically, where we desperately need you is in city and county council meetings, speaking up at the budget items that they talk about, because somewhere they spoke about the fact that they were going to be giving our money away to Texas and to other CBCs, and we did not raise our voices loud enough. We need more voices desperately for those who can. If you can't, that's fine.
Wow, that's a really concrete step to take. I personally always love concrete steps. And I think your point about if you have the ability to attend those meetings, these are budget items. And this is, as you said, our money being funneled perhaps towards places, services, institutions that we don't want. I think that's just a really, really important point to make, that there is something that you can do. We are closing in on the hour, and that sort of segues into my next. I want to give everybody on the call, if they would like, to tell us what we can do as audience members. If we are interested in this topic, interested in ensuring reproductive health care justice for all North Carolinians, what can we do? We've just heard one concrete thing. Are there other calls to action, as it were, from those people on this call?
well, I would start with, North Carolina is one election away from not being a safe state for abortion care. So I think the most important thing that we can do is vote for candidates who are not for forced birth. And beyond that, I think funding Carolina Abortion Fund, that I can't tell you how many patients I refer to CAF to support with transportation and other funding. And then education, going back to Monika and Maya, I think making sure that we're educating our teens, educating our community members about not just the issues that are going on, but about the things that they can do, about the candidates that can help, about what Camille was saying about local government and all that as well. So I will pass that on to whoever wants to go next.
Okay, calls to action. What can we do?
I'm going to piggyback on Patrick. Education is key. Education is key. One of the things that we are missing right now is all of our teens. Once our teens graduate for our program, we keep them. They get into what we call an alumni, and that alumni can do things within their community. And what we missed is we usually take our teens to the legislative building yearly and to talk to legislators and things like that. And so we haven't been able to do that, but just education. And so we try to provide education to our teens in that way as well. So education is key.
So your call to action then would be to take advantage, right? For those people on the call who have children or are aunts or uncles or, friends with youth, there are places like your teen programs from Planned Parenthood that can help educate young people as well as parents about making good choices and understanding their reproductive rights. Others, we have about a minute. Other calls to action you want to highlight before we move on to closing? Tara, go right ahead.
So what everyone has said has been great. And I think also really using our voice. I mean, one thing about abortion access and the very intense attacks right now is that it can be easy to feel disempowered, particularly because abortion is so stigmatized, but we are the majority of people in this country and in this state do support abortion access. People have lots of feelings about lots of things, but they also have a lot of misinformation. And so I think for us to be able to speak honestly about our experiences and to also talk about the support that we have for people accessing abortion, and talk about that with your state lawmakers. I mean, Congress as well, but definitely your state lawmakers. They're the ones giving money to CPCs. They're the ones enacting these restrictions, and they do it because they create these false narratives. And they also say, you know, most people support these things, and that is not true. So let them know that, you know, if you're able to do that at Pro-Choice NC, we always have ways that we can help people know how to find and call their lawmakers and talk to them about what is important to them.
Thank you. I'm going to stop this discussion right now just because we have one more minute. And Ava, would you be able to put up the last slide, which is some of the resources that our panelists have shared with WomenNC to help our audience members know more and that sort of thing. The slide will be put up, and it'll just be put up briefly because we'll end soon, but we will be putting it on this Facebook post. It will be available at our website. We will also have the websites of all of the panelists that participated today so that you can contact them with individual questions you have. But take a look. Here are some links to everything from the CPCs we've been talking about to how to help fund abortions and other reproductive health care services for folks. Again, we will have this in this Facebook post as well as on our website, as well as links to all of our panelists and their organizations. So you can see who's been on our call. So anyway, I think I'll stop now. We do like to stay pretty close to time so that people can feel as if they have seen everything we have to offer for this hour. We thank our panelists so much for talking to us about reproductive health care access and justice in a fraught time. Someone said, I think it was Camille, I don't know if that was quite her word, but it was a synonym. It is a fraught time. And I hope we brought a little bit of clarity, a little bit of understanding to some of the issues that attend this time for those seeking the full scope of reproductive health care, including abortion in North Carolina. I wish you all a good afternoon. And once again, thank you all for joining us. Thank you, panelists, and thank you, folks on Facebook. Goodbye.